Follow the conversation. This is Afternoon on the Dove.
Good afternoon. Welcome to Afternoons on the Dove, and I'm your host, Perry Atkinson. Today, we are delighted to have back in the studio with us Nisha Jackson, certainly no stranger, and she is the founding partner, person, president, queen.
Ooh, I kind of like the king
Oh,
thing.
Vantana Wellness.
Good.
Yeah, well, whatever you want to be, you're it. And we're here to talk about your health. And by the way, if you want to join the conversation, you're welcome to do that. Our phone number is 776-5368, and we can conference you in anywhere along the line. So, nice to have you back.
Thank you.
Happy almost September.
I can't even believe.
Isn't that
I
something?
can't even believe it.
I can't either. Hey, pain.
Pain.
I have people that are pains in my life. Can I take a pill for that?
Yeah. Well, we're going to talk about a few things that you can do about, controlling your pain today, because it's a huge issue. There's so many people in pain. I cannot believe today versus even 18, 20 years ago when I first started practicing medicine, how many more people are in pain today.
Pain.
And I keep thinking, trying to connect the dots between diet and stress and, people's sedentary lifestyles and chronic pain. And I'm not sure we've all, as a medical community, really connected those dots, but there is a connection between how we live, what our lifestyle is like, and how much pain we have. So I'm going to talk about that today on today's show. So I'm hoping lots of people call in because this is a big topic.
You're welcome to do that, 776-5368. And by the way, coming up a little bit later on, you're going to have a special guest about pain as well. And who are we going to have?
Yes, today we have Mitchel Yass. He's been a guest on our program here before, and he's so enthusiastic about pain. He's excited about pain.
He likes pain. Huh?
He's a very dynamic speaker, and he's going to be joining us today. He's written a book called Overpower Pain and has a whole program. He's a physical therapist and has a whole program to treat pain that's very, very, very effective.
Are we getting operated on too soon because of pain?
I think so. I think that we jump to surgery much more quickly than we should, although the neurosurgeons today are much more careful about that because of the study that came out not too long ago, a couple of years ago, that showed that there really wasn't much of a difference in low back pain surgery versus physical therapy and other palliative measures. And so they've really not jumped to having back surgery as often as they used to. I mean, we used to do laminectomies and discectomy surgeries, first time somebody had an injured back. And now we really try other things, which I think is a good route to go. But the reality is there's just too many people on pain medication. And, the problem is that our lifestyle is so crazy and so busy that if you have, let's say, low back pain, because that's the number one cause of pain today is low back pain. If you have low back pain, you got to get back to work. I mean, you can't take a month off and do physical therapy and, do acupuncture and do all these things. So what happens is that people go back to work so much more quickly than maybe they should before they've really been rehabbed or before they've treated the problem appropriately. And then they can't function very well because they're in so much pain. So that's what kind of sort of predisposes them to this chronic use of pain medication.
Now, you made mention a few moments ago there may be a connection between pain and diet.
Yes. Well, the rates of obesity are so huge.
I just ordered a mushroom burger. And I just
Shh, don't say that on the air.
Okay.
The rates of obesity are so incredible today. In fact, they estimate 60 to 70% of America is overweight, and that 30 to 35% of America is clinically obese. In fact, I was just looking at this map this morning. I was looking at this map of the United States and how each state ranks in the incidence of obesity. And I am just appalled at how many states have gone up even in the last couple of years in the incidence of obesity. The percentages have doubled in the last 10 years.
Wow.
So the problem is that the foods that we're eating are often inflammatory, meaning they cause inflammation in our body, and that leads to more pain. So there is a direct correlation between the foods that we're eating that are making us fat or overweight are also the very foods that are causing more inflammation in our body. So I definitely want to address what those foods are today and maybe some things that you can do if you're in a lot of pain and you want to get help for that, even through your diet.
All right, let me just say to our viewers and listeners, if you're watching on television right now or listening on the radio, you're welcome to talk to Nisha, 776-5368. One other quick question, fibromyalgia. Obviously a tremendous pain issue, and has it been overdiagnosed, or is it legitimate?
I think fibromyalgia has been a catch-all diagnosis. It is very real, though. People really do have the diagnosis of fibromyalgia or I call it muscle arthritis, muscle pain. The problem is that I don't think that many of the medical providers out there are digging deep enough to find out what may be underlying that problem. And we do jump to anti-inflammatory drugs and pain medications too quickly. My personal experience has been in the office is looking at some of those underlying hormone problems, whether it be low testosterone, low thyroid, low progesterone. All of those hormones being off can predispose somebody to what we would call fibromyalgia or muscle arthritis. And it's amazing to me how many people get better when you balance their hormones and then get them on the right diet and help them manage their stress, get them to sleep at night. We know that even with chronic pain, the average American will lose multiple hours of sleep per year. In fact, one study looked at the average American losing 200 hours of sleep a year due to pain.
Really?
So the average person that's in pain. So it's really significant. And unfortunately, when you're losing sleep, you have more pain.
Wow.
So that's just the snowball effect on
All right,
pain.
I want to get into some of the diet things and have you connect those dots. We want to take your phone calls as they come in as well. Hi, Gary. You're on the air with Nisha Jackson. Are you there, Gary?
Yes, I am.
Go ahead.
I've had chronic pain for years. I was on a blast pad in Kirkland Air Force Base, and you can look that up online. And they blew C4 up next to me, and it basically damaged my bones and caused me to have lung problems and so forth. And I've been on this thing called Foods That Heal.
Yes.
Like eating asparagus, a source of glucose, a protein antitoxin that reduces cancer risk, avocado, good fat. I mean, I can go all the way down the alphabetical thing here, but it's just, I don't know if you guys have tried that, but it's done wonders for me.
Well, I think that anything that you can eat that's from the ground, foods from the ground, foods that walk around, nuts and seeds, basically whole foods are the best anti-inflammatory foods that you can eat. What you don't want to do is eat foods that are packaged foods, artificial foods, foods that cause more inflammation in your body, particularly sugar and sugar-type foods are the foods you really want to stay away from. So I'm assuming you're trying to do that at this point?
Yes, I don't hardly eat anything that's sugar. It's like basically I've got a list of foods here that I can eat, like berries, brown rice, broccoli, cabbage, carrots, cauliflower, chili peppers, chocolate, corn.
Yes.
Dates, eggplant, eggs, fat-free milk.
Right.
And they say to stay away from the milk a lot because a lot of people are having like allergic reactions to it now.
Right. You know, I think that it's important to stay away from the most common food allergens because sometimes people have chronic pain, but really they're just having a food allergy. So the most common food allergens, of course, would be the wheat products and the dairy products, artificial colorings, artificial flavorings. So even just staying away from those foods can lend quite a bit of help to somebody who has chronic pain. Sounds like you've had a doozy in your past. I'm glad you've discovered foods that heal.
Yes.
Okay. Thanks, Gary.
All right. Thanks for your call. Good luck to you.
All right. 7765368. Give us some of the other foods that could cause this.
You know, some of the things that I think are really helpful is adding supplements like fish oil. There's been numerous studies that have shown that fish oil reduces inflammation. The other thing that reduces inflammation is the spice turmeric or curcumin. Mm-hmm. And just adding curcumin, or you can even take it in a capsule form, 1,000 or 2,000 milligrams a day, is very helpful for reducing inflammation. And again, multiple studies have been done on how turmeric or curcumin reduces inflammation. So that might be another thing that people can add. Basically, what you want to do is you want to get back to what Grandma was doing. Eating foods that are real foods, you know, not foods that are packaged. So staying away from the aisles in the grocery store and shopping the perimeter of the grocery store and filling up on those foods, especially with kids, because even the segment of population now that's really growing for chronic pain is children and adolescents. So they're getting injured easier, and one of the things that is happening is that there's just too much inflammation because they're eating a diet that's high in inflammation.
Obviously, sugar is a big contributor.
And kids are drinking 40% of their calories today, and it's just absolutely sugar.
All right, let's go back to the phone. Hi, Kathy. You're on the air with Nisha Jackson.
Hi, Nisha. I am actually a patient of one of your people at the clinic there. But I've been going through gastroenterology because I was having serious colon problems. And finally, after months and months of testing, we've eliminated food allergies and all that stuff. And I've been taking lots of herbs and things that are supposed to be healing and good for the pain and everything. But I found that every time I try to go off Advil, I get worse on my pain despite all of the other things I'm doing. And yet, the last test, a colonoscopy, found out that I have inflammatory colitis. And they told me that what's been going on is all the things I'm doing for anti-inflammatory is actually inflaming the colon, and apparently the Advil's the worst. But my pain goes way out of line when I try to go off of that. So I'm trying to do all these herbal things and stuff, but it's still not controlling.
So
and I don't want to do a prescription drug if I can help it.
So you're looking for an alternative to Advil?
Right. So I would say the turmeric or the curcumin would be the best option for Advil because it's a natural anti-inflammatory. So it acts very much in the same way as Advil, reducing the prostaglandin chemical, which causes inflammation. So that's what I would recommend is either higher doses of fish oil and or turmeric or curcumin would be good options for you.
Well, I just found out about what do you call it, curcumin, just a couple days ago. And the price that they had on it, the health food store, was kind of unaffordable. So I've got to try and balance cost too.
Well, and you can cook with that too. Obviously, it's an Indian spice and it's used in a lot of different dishes. So I would definitely start adding that to your one of your spices that you cook with too. All right. Well, best of luck to you.
Okay.
All right. Thank you.
Thanks for your call.
All right. A couple of other minutes here, but what do you do for other than Advil, and what are some of the other ones that are out there,
Right. See, the part of the problem that I'm hoping we have a chance to get to today is the chronic use of pain medication. Once you start, I think pain medication is handed out way too easy in the office. And what happens is you sprain your ankle, you hurt your back. Well, let's just give you a weekend of pain medication or a couple weeks of pain medication. And then people find out that they can use that and still function at a really high level. The problem is that they never want to go backwards, right? So they continue to use it.
Well, you're addicted.
And then you're addicted to it. So not only are you addicted to it, but it loses its effect with time, which means that you either have to add other things to it or you need to take more. So that leads to the whole abuse potential of the medication. So there really is better ways, and we're going to talk about some of those solutions today. Acupuncture has been very, very effective for pain relief. The non-steroidal anti-inflammatories, the natural anti-inflammatories can be very helpful. But getting to the source of the problem, even looking at the diet and some of the hormones, some people even have low thyroid and have chronic pain but have never diagnosed with low thyroid. So really looking at some of the underlying conditions, I think, is the best place to start. Even when you've had an injury, looking at that, because people heal faster when their hormones are balanced. It's amazing. Those hormones are crazy.
I know. It all comes down to hormones sooner or later. I just got a little note here that somebody's calling in and say Walmart has cheaper...
curcumin.
Yeah.
Yes.
Yeah,
great.
Okay, well, there you go.
All right.
All right, back to sugar. Is that the number one bad thing?
Well, it's not. It's just hard because the sugar and the high fructose corn syrup and all of the artificial sugars that are out there that are very inflammatory, it seems like they're in everything, every food, unless you're eating a whole food, a real food. In fact, I got a kick out of somebody in the office this week. I was telling her that she really needed to start eating whole foods, like real foods. And she said, What is that? We've gotten so far away from it that we don't even really know what whole foods are.
Wow, that is...
So just getting back to what Grandma did is the best way I can describe it.
All right, let us take a quick break. We'll be right back, and you're welcome to join us. 776-5368. Nisha Jackson's here with Ventana Wellness, and we'll be talking to Dr. Yass as well, and you can join the conversation. Again, 776-5368, and give us a call. And your website?
VentanaWellness.com.
VentanaWellness.com. There you go. Thank you.
Follow the conversation. This is Afternoon on the Dove. Follow the conversation. This is Afternoon on the Dove.
Nisha Jackson's in the house with us today with Ventana Wellness, and you can go to VentanaWellness.com. That's the website that'll just get you all kinds of information, and we're talking about pain. I don't know anybody that doesn't suffer with pain.
You don't know anybody that suffers with pain?
That doesn't suffer.
Oh, I know. It
chronic.
transcends every segment of the population, it seems.
Yeah, and you know what's interesting is the levels of pain and tolerance. I have a high tolerance for pain.
Right.
And I have a low tolerance for people that don't have a high tolerance.
Right. Right. You know, I actually heard this story. That I'm glad you said that, because I heard this story recently of a lady.
Yeah.
She was pretty dramatic in her emotions, and you know that sometimes can lead to more pain expression, right?
Right.
So she came out, she was grocery shopping, and she came out and she got into her car and she put her groceries in the back seat and she sat in the driver's seat and she was getting ready to start the car, and all of a sudden she heard this big bang, and then she felt something really hard hit the back of her head, and she thought for sure she'd been shot in the head.
Oh.
Right?
Yeah.
So she grabbed the back of her head and she held onto the back of her head, and she rolled, and what she felt was this kind of this globby, wet feeling, you know, and she thought her brains were coming out of her head. She immediately had this enormous amount of pain that shot through her body. She started sweating and she was crying, and then she eventually passed out in the seat. Well, somebody noticed that something was wrong next to her, so they called 911, and the emergency services came out, and they got to her, and she says, you know, she was awake at that point, and they got to her, and she said, "I've just been shot in the back of my head, and I'm holding my brains in, and I've got extreme pain." Well, what had happened was one of those Pillsbury dough containers she had purchased at the store, and it exploded in the back seat because of the heat.
Really?
And it hit the back of her head, and she thought her brains were falling out, but she had this intense pain in her body. And I say that only because people's perception of pain is so varied.
Whoa.
Right?
Yeah.
And it's kind of a silly story, but it's very real that the mind, whatever is happening in the mind, can be very much reflected in the disease of the body.
All right, let me,
and I think Mitchell will have a few things to say about that.
Introduce your guest. We have a call, but introduce
Yes.
your guest today with us today.
Mitchel Yass is the Miracle Man. He's actually known in New York as the Miracle Man. He is the founder and owner of PT2 Physical Therapy and Personal Training in Long Island. He's a physical therapist, and he's helped thousands of people avoid surgery, thousands of people get off pain medication and avoid becoming addicted to pain medication because of his personal program. He actually has written this book called Overpower Pain, Mitchel Yass, Y-A-S-S. And you can go to his website, mitchelyass.com. Welcome to the show again, Mitchell. You're always so loved on this show.
Thank you for having me again. I appreciate the opportunity to speak to everybody. So.
All right. So what do you think about that story about the lady with the Pillsbury dough exploding in her backseat and hitting the back of her head?
I'm sure it was quite a surprise to her when she found out what actually was causing pain.
It's a good story, though, because I think people tell themselves, I'm in pain, I've got a ruptured disc in my back, I'm done, I don't know what I'm going to do, I'm going to be on disability and pain medication, and all of a sudden it becomes so enormous in their head that their pain is really increasing due to what they're telling themselves.
Yeah, there's absolutely no question that there's an emotional attachment to pain. And so once the person has pain, and more importantly, a sense that the pain cannot be resolved, that starts to fester in their brain, and fear begins to come in saying, well, how am I going to live my life like this? How am I going to be able to deal with my family members? Or how am I going to be able to sustain my job? And it's a very, very scary feeling for people to think that they have pain with no end. So I think there is an emotional attachment that occurs, and it enhances the expression of pain that they're feeling.
Yes, exactly. So I want to talk to you and have you explain to everybody what your position is in your office and how you founded this company, and a little bit about why you thought it was important to come up with a different type of program for people who have pain.
Okay, first off, let me just mention that along with the office in Farmingdale, New York, I've also opened an office in Boca Raton, Florida.
Wow.
Of which I'm sitting right now. That's where I actually am. Last year, I opened an office here. And basically what happened was I went to medical school, and I'm being taught that the typical method for diagnosing pain comes through the use of diagnostic tests like MRIs and X-rays. And they were basing their treatments on these type of diagnoses. For instance, if someone had back pain, an MRI found a herniated disc, and so we're going to somehow try to treat a herniated disc with ultrasound or electric stimulation. And it was just illogical. It made no sense. Just about at this time, they were beginning to get studies coming out saying that like 70% of the population who have no pain have herniated discs, and conversely, people in extreme pain don't have herniated discs. So they were beginning to get rumblings that there was no correlation between these type of diagnostic test findings and pain. And so I happen to have a very strong weightlifting background, and I started saying to myself, well, instead of it being about the structures, maybe pain was being created by the forces on the structures, and the structures were simply being misaligned, like the two bones that make up your shoulder or your knee, or even that the muscle that was in your back was actually in creating the pain signal, and that's why you were having pain. So I started to look at it more in that sense and try to understand how muscles can create pain, and I was able to prove that in 90 to 95% of the cases, the actual tissue creating the pain signal was muscle, and that ultimately targeted strength training was the key to resolving people's pain.
So on strength training, you know, I think that that's one of those things I talked about earlier in the show that it's so difficult for people is that takes time, right?
Well, yes, that is one of the things I deal with. Unfortunately, what happens is that in many cases, if I'm able to, when a muscle is in pain, it's typically because it's strained and shortened and thickened. So with a treatment of massage and stretching, oftentimes I can get that muscle back to its more optimal length, and as a result, it will not strain, create pain, and will allow for greater function. Now, what happens is the person says, miraculous, wunderbar, I'm done. But that's not the answer. Ultimately, you have to strengthen the muscle to the point at which you can perform your activities and not allow the muscle to strain. That's where the long-term process occurs. And unfortunately, for some people, they think that there is a magic bullet, and there is no magic bullet. You have to allow yourself to heal itself. And through strength training, I simply guide you. I try to assist you in allowing your body to heal itself and then allow you to function without pain.
Yes, I think that that's so important. And I'm amazed, Mitchel, at how many people have a terrible imbalance between the right side of their body and the left side of their body. And that comes out often in weight training where you're not as strong on one side of the body as you are the other. And that can lead to pain.
What's interesting is I can't tell you the number of people who ended up coming in, let's say, for left-sided pain, and I'll say, you know, tell me your story, and they'll say, well, what happened was originally I had pain in my right leg, and eventually over time that pain went away, and suddenly now I have the pain in my left leg. And what the person's confused about is how is it that they started with the right and went to the left, and all that's happened is they had pain on the right, they excessively weight bared on the left to the point where now they've strained the left-sided muscles.
Yes.
And that's where their pain is being exhibited.
Exactly.
That's the only reason why they've seen that happen. And ultimately, the only way to resolve pain is to make sure that both legs are balanced so that you could weight bear evenly through both legs.
You're so smart, Mitchel. We're going to take we're going to take a caller right now. Somebody's called in on pain.
Hi, Randy. You're on the air. Go ahead. Are you there, Randy? Okay, maybe we lost him.
Randy's in too much pain.
Well,
Randy, call back.
He was waiting a long time. Yeah,
All right.
776-5368 for those who want to join us.
All right. So tell me a little bit more about, you know, number one cause of pain in America is low back pain. So, and I even read a statistic this last week that 80% of all people by the age of 80 will have some type of chronic pain. So I guess it's inevitable, right? So tell me a little bit more about sort of the current medical establishment's approach to pain management and your thoughts on that.
Actually, there's been a tremendous change in perception regarding the use of diagnostic tests since the last time we talked. First off, let me just mention, to quantify the number of people in chronic pain, the Institute for Medicine, which is the governmental agency who just recently put out a report, has stated that 116 million adult Americans suffer from chronic pain. So it's a gigantic number.
Wow, that's even higher than the stats I was looking at. That's enormous.
This just came out about 3 months ago. One of the fascinating points that they made was that one of the core reasons they believe this is going on is because there are no standalone pain courses provided in medical school for any specialty. So that was one of the interesting points that they made. In February, the American College of Physicians came out and has now recommended that X-rays or MRIs no longer be used to diagnose the cause of back pain because they showed that there is no correlation between positive findings such as herniated disc stenosis or degenerative disc disease and pain. They actually quantified it and said that in 85% of people coming to primary care, their pain could not be attributed with a spinal abnormality. That is a shockingly high number. And what they're saying is they're simply describing it as that 85% having non-specific pain. Well, to me, it's not non-specific. It's clearly muscular, and there are clinical techniques to prove that it's muscular. And that's really what I'm trying to get across to people, is that the diagnostic test is not in a position to establish what tissue is creating the pain signal, because until you establish that, how could you address that tissue appropriately and resolve pain?
Well, that confuses me even more than I was before I started the show. We're going to take another caller. Mary Beth, you're on the air. Welcome to the show. What's your question today?
Hi, I actually have a comment. I
Good.
went to the health food store and purchased turmeric, cayenne, and ginger and made my own capsules, and you know what? It's pretty inexpensive.
Excellent. You know, I was going to mention that, but that gets a little complicated. But buying those gelatin capsules and making your own, is that what you did?
Yes, it is.
All right. Well,
and
that's...
just one other question.
Yes.
I'm having a brain fade.
Uh-oh. Take some turmeric and call back.
Oh, I know. Antidepressants like Cymbalta with pain, are those recommended or not?
You know, that is another fallback that we often use in the medical community to treat pain. And I think in some cases it does work, but I really hate to go that route. In fact, I personally in my medical practice never go that route because, again, I think it's just putting a Band-Aid on it and not necessarily fixing the underlying condition. It just, in some cases, it may be necessary. It's just not the direction that I would like to go. But again, it's one of those things that after a while, it stops working. You need to add more. You need to cocktail with other medications. So it's really not the direction that I like to go because I think that getting to the underlying condition or problem is really what you need to do.
All right. Thank you.
All right. Thanks for your call.
All right, we need to take a quick break. We'll be right back. And if you want to join us, 776-5368. When we come back, what are you going to ask Dr. Yass?
Well, we're going to talk about diet and specific exercises that people can do for low back pain.
Ooh, okay. We'll be right back.
Follow the conversation. This is Afternoon on the Dove. Follow the conversation. This is Afternoon on the Dove.
Dealing with the big subject of pain today, and Nisha Jackson's in the house from Ventana Wellness. VentanaWellness.com is the website. Let me encourage you to check it out. It's an incredible resource. And you got an incredible guest today.
Yes, Mitchel Yass is on the air with us today and in the studio via Skype, and we're so happy to have him because he's so smart. He is the king of getting people out of pain by his special program. He actually has authored this book right here, Overpower Pain. It is a book available in all bookstores, and you can go to his website to get more information about his particular program that he uses to get people off the surgery table, get people off prescription pain medications, and it's very, very effective, and it's the stuff that you should be doing anyway, which it's the things that you should be doing, taking the time to do because it's good for you in many, many other ways. And it helps you age better, too, which I think is important, and you look better, too. So Overpower Pain, Mitchel Yass, welcome back to the show, Mitchel. I hope you're doing well this week. It's been a while since I've talked with you.
Yes, everything's been great, and what's probably most exciting to me is the fact that there have been so many more bits of information coming out that are really reinforcing that what I'm saying is correct, and that the kind of basic mentality that the mechanism for identifying the cause of pain through diagnostic tests is invalid. I believe it was April, I think it was, the Cleveland Clinic puts out a newsletter called Arthritis Advisor, and they actually, in that newsletter, stated in absolute unambiguous information that most back pain is muscular. It was absolutely amazing, and they specifically noted that getting surgery for a herniated disc when back pain is the primary symptom is invalid and should not be done.
Interesting. Well, that's good to know. We have a caller. Kevin, you're on the air. Welcome to the show. Tell me what your question is today.
Well, actually, more of a comment.
Okay.
You know, and I love this guy that you've got on because he relates so so absolutely perfectly to my situation.
Oh.
I was getting older and thought that it was all, my pain was related to my age. I've had back surgeries and knee surgeries and multiple broken bones, and I figured I was just getting old. Well, my wife basically said, no, we're not going there. You're going to start doing some exercises, stretching, change your diet, get rid of the sugar. And I'm in my 50s now, and I'm in no pain at all.
Isn't that interesting?
And it was totally muscular related.
Yes.
Once I started stretching the muscles back out where they belonged, eating a good diet, and getting plenty of rest and water, the pain is gone.
I think it's interesting, Kevin, that that this is a huge surprise to us. And I'm amazed when patients come in and say, I took control of my life. I got back to the gym. I started eating better. I started taking care of my sleep habits at night. I started taking some supplements and just getting back to like what we're supposed to be doing.
Absolutely.
I think it's always interesting that we're just always amazed. Wow, it really worked. That's what we really should be doing with our bodies anyway. So
exactly.
I'm thrilled that you had that experience, because that's exactly what we should be doing.
Well, and it's exactly what this gentleman's been saying. It's not so much about the medicines you can take, but what you can do with your body in a natural form to stretch your muscles back out the way God created them to be. And it's amazing.
Excellent. Thanks for your call, and keep up the good work. All right, so Mitchel, I want to talk about low back pain. I've actually, as you probably remember, I've had 2 back surgeries, so I understand chronic pain really well. Fortunately, I've never taken pain medication ever, and I just don't even tolerate it, and I'm so afraid of it anyway that I would never take it. But I think it's something that we have to talk about, because it's the most common pain problem out there. So maybe we could give our listening audience and the people that are watching us on the air some ideas of what they can do, exercises that they can do to help with low back pain.
Absolutely. Let's start off by just giving the understanding that in most cases when you're having back pain, the tissue actually creating the pain signal is the lower back muscle. I know that someone's going to present you with an MRI that's going to say you have a herniated disc or stenosis, but all they found in that is a structural variation that has been proven to be in as many people without pain as those with pain, almost in the same percentages. So the only reason why you've gotten the MRI at this point saying that while you have pain is because that just happened to be when you got the MRI. If I resolve your pain and you go back and take the MRI, you'll still find that herniated disc or stenosis. So they have to begin to appreciate that these structural variations have no correlation to their pain. So if the low back muscles are creating a pain signal, there's a reason for it, and the reason typically is that other muscles that work in conjunction with the low back muscles have strained first, causing the low back muscles to overwork and then causing them to ignite the pain signal. So in most cases, when someone's having lower back pain across the entire back, it's because their front thigh muscles, their quadricep muscles, are much stronger than the hamstring or posterior thigh muscles. And what that does is it causes the front thigh muscles to shorten, and because they're attached to the pelvis, they'll pull the pelvis down in front, causing an arching of the lower back. When the lower back arches, it causes the low back muscles to shorten, strain, and lose their ability to support the torso. That's why you have back pain. So the resolution would come from stretching your front thigh muscles and strengthening your hamstring and glute muscles. That would be the most common way to resolve back pain that's across the lower back.
All right. Well, those are good tips. I know that has helped me enormously over the years, is staying in the gym and staying in my weightlifting program. I don't even know what I would have done if I wouldn't have had that. So I'm glad that I have that. I want to go to the next caller. Josh, you're on the air. Welcome to the show. What's your question today?
Josh?
No, Josh.
Yes.
Oh, Josh. Hi, Josh. Welcome to the show.
I got some static there.
Okay. What's your question?
Thanks for having me. Well, I'm a complicated case, so I've got 1,000,001 questions for you.
Well, what's the first one?
Let's take the one.
Well, what's hit me most recently is I've come down with the flu, and, having chronic back pain. Let me digress. In '97, I broke my back. About 9 vertebrae, 5 ribs, my sacrum, and, well, let's just say it's a miracle I can walk.
Right.
Since '97, every day has been pain. Trying to find a way to get rid of that pain has been a headache, but a lot of it I've found is accepting the pain.
Right.
Now, back to the flu. When you have the flu, you know those body aches you get.
Yes.
It's tenfold when you've got this chronic pain.
So what are you doing now to help with the pain, and how might Mitchel be able to help you today?
Well, currently I take Celebrex, which it has really done wonders for me. Again, I'm kind of an extreme case.
Right. And what part of your body is hurting the most? Is it your lower back or upper back? Or?
Well, I've got herniated discs. Well, actually, I have black disc disease, which is a degenerative disc condition.
Okay.
So
Mitchel, do you have any comments that you want to add that might be helpful for him? I know I was going to show this to our viewers. This is an example of the inside of the book, and he actually has these great pictures of the weightlifting poses that you can use for particular problems in the body. And I'm thinking that, Josh, this might be a book that you want to think about getting, and you can focus right into the area that you're having the problem and start very slow, go slow, start slow, and maybe that would be a good option for you. What are you thinking, Mitchel?
Okay, I just want to make a point. If you listen to what Josh is saying, he's been told that the cause of his pain is the result of herniated discs and disc disease based on one simple answer. He had an MRI that found these discs. I would think he would agree that that's how they established that that was what was causing his pain after he had the fractured vertebrae. My point is that what you want to try to establish through a clinical evaluation is to determine what actual tissue is creating his pain. If he's having pain across his back, a herniated disc could never create pain in that location, and he would have to start to open up to the idea that maybe it is muscle that's actually creating the pain signal he's experiencing. And if that was the case, then you would have to go on and try to understand, well, why is his lower back muscles creating so much pain for him? But in terms of the Celebrex, the point that he made, Celebrex is an anti-inflammatory, but as with most non-steroidal anti-inflammatories, there's an analgesia component to it, and it acts as a sedative. So I don't necessarily know if his pain is associated with inflammatory issue or simply that he's having pain triggered by an irritated tissue, which in fact might be muscle, and that the sedative aspect of the drug is what's giving him his pain relief.
All right.
So,
well, I think that's good information to share with him, because I totally agree with you, and I see that over and over again, and then we get locked onto that diagnosis, and we can't really go to recovery, and we got to get to recovery. So I love that's what your whole book is about. That's what your whole program is about. I want to make sure we give your website information. It's Mitchel, the name Mitchel Yass, and it's Y as in yes, ASS. MitchelYass.com. What kind of information can they get from your website? I think your website's great, but how can that be helpful to people that go to the website that are suffering from pain?
Well, I think that what I've really found myself doing is trying to be an interpreter to people, an advocate for people who are in pain. I think the existing system is basically limiting them, as you said, from getting the true diagnosis, because the diagnosis is simply achieved through these diagnostic tests. So I try to provide tremendous amounts of information in terms of how the person, through understanding what triggers pain, can determine what tissue is creating the pain. And if it is found to be muscular, then the reality is that only targeted strength training can be utilized to resolve the pain. I'm trying to provide more and more information about the use of medications, why that doesn't benefit them, why getting a cortisone shot or an epidural nerve block does nothing but mask the symptom and delays the inevitable, which is to establish what tissue is creating that pain signal. So I really try to give people the ability to differentiate on their own by understanding some of these concepts, how to determine what is causing their pain and what direction to go through. And by the way, I'm not saying that every single case of pain is from muscular deficits. I'm saying that the goal is to determine that through a clinical evaluation. I have proven that in 90 to 95% of the cases, the cause was muscular. And in the other cases where it was structural, I totally endorsed the use of surgery. But you can't see one as the answer unless you still have pain and then go to surgery. You either have a muscular deficit that requires strength training to resolve it, or you have a structural deficit that requires surgery to get it. Now, you can't say, I'm going to try all these things, and if I'm still in pain, well, the last resort is surgery. If it's a muscular deficit, surgery will never correct the problem, and that's why you see all these numbers rising in the number of people suffering from chronic pain. It's clearly indicating surgery is not resolving the cause of most people's pain.
Well, it's an ongoing problem, and it's such a huge problem that we've actually pulled together a whole team of professionals to just have a pain clinic within our clinic, because there has to be a better approach to dealing with this pain and dealing with all of the people that are given multiple amounts of pain medication. And many of those people actually want to get off the pain medication. They don't want to have to rely on it, but they don't have a plan. So I think putting that clinic together will be very, very helpful, especially in our area. We still need to fly you out here sometime so that you can put some of our physical therapists on your program you've developed and really teach them, because I think that that would be really helpful. But for now, we have your book, Overpower Pain. I'm going to hold it up one more time. Overpower Pain by Mitchel Yass. It's available in bookstores, or again, you can go to his website, mitchelyass.com. It's loaded with information on the website. And again, you can go to my website, ventanawellness.com, if you want more information about our services. Mitchel, it's always so nice to talk with you. I love the work that you do. I love it because it works. And I appreciate all the help that you do.
Thanks for having me. I appreciate it. And the opportunity to reach more people, that's what this is all about.
Absolutely. Take care and have a wonderful week, and stay pain-free.
There you go. All right. Thank you, Nisha. And again, that's ventanawellness.com. And today we dealt with the back. Tomorrow we're going to deal with the head and the heart.
Follow the conversation. This is Afternoons on the Dove.